Good evening. This is Dr. David Tam, President and CEO of Beebe Healthcare, and today is one of our ongoing town halls for the public to talk more about COVID, the vaccine, and where we are as a healthcare resource for the community here in Sussex County. I do want to make sure and let everybody know on this that it is being recorded, and as such, we do talk about the fact that it is the 22nd of September. That's Wednesday, September 22nd, 2021, and the time is 5 p.m. I do that because we want to make sure that as people see these, especially as they are being recorded, what time we did this work. Why? Because some of this information changes on a moment by moment basis. It's how fast the science has changed or the FDA's recommendations have changed. And so we want to make sure that you understand that this is the best information that we have for you effective today, Wednesday, September 22nd, 2021 at 5 p.m. I'm also kind of doing this because we did have a technology challenge where now we are on Blue Jeans Live and we'll be recording this and of course posting it on various sites. So if you're somebody who just got on because you got on the Facebook post and the Facebook Live event was not active and now have switched on to join us on Blue Jeans, please know that once again, we just started. This is once again Dr. David Tam, President and CEO of Beebe Healthcare, and today is September the 22nd, 2021, and it's the COVID-19 Public Town Hall. Now, just like the other town halls, we're going to give you the most up-to-date information. Joining me later, of course, will be Dr. Bill Chazanoff, our COVID-19 Medical Director, Infectious Disease Expert, and also now our Vice President for Population Health to share with you the latest information that we have about everything from masking, vaccinations, third dose, boosters, and what COVID-19 and its variants are doing both here in Sussex County as well as in Delaware and across the world. However, I do want to share with you a few things just to make sure that we're on this together, because administratively or as a leadership of a health system, I want to once again reiterate something and go over something that I know has been a little confusing. That COVID-19, as Dr. Chazanoff will share with you earlier, recently, of course, as a result of the Delta variant, has undergone an upsurge. We have worked very hard in the state of Delaware to try and keep that at bay. You know that if you watch the national news, that upsurge has had terrible impacts in places in other parts of the country, like in Houston or in Texas and Houston, Tennessee, Florida, Idaho. Here in Delaware, it has been a slow but steady increase. And even though the health systems have been doing well, we in the last several weeks reached a point where our emergency rooms and our ICUs were impacted. I will be the first to tell you that it is not just COVID-19. It is also the fact that we have so many people who are sick, perhaps because over the last year, people may have not gotten their medical care, and as such, things like their diabetes or their hypertension and things like that may have gotten out of control, resulting in them coming to the heart attacks or other conditions that do require a hospital stay. But regardless of this issue, whether it's because we've had more patients with COVID-19 come into the hospital and have severe illness, or because we also have had an increase in patients who have not necessarily had COVID-19, but indeed have other serious illnesses that require hospitalization, we reached a point here at Beebe Healthcare, your local nonprofit independent community health system, where our emergency rooms were heavily impacted and we had long wait times. People who were spending long times in our emergency rooms waiting for a bed if they were to be admitted. And really the other issue is patients who are in the hospital who couldn't go someplace like a rehabilitation facility or a skilled nursing facility because all those other health system areas outside of Beebe Healthcare were also impacted. Every health system in the state of Delaware has been impacted in a similar way, whether it was Christiana or Bay Health or Nanticoke, and we have been working very hard partnering with those agencies and those hospitals and health systems to make sure that we provide the very best care for every Delawarean in the most appropriate and equitable manner. And so, watching this on an ongoing basis for the last several weeks, Beebe Healthcare's leadership made a very difficult decision that in order to provide the safest possible care, which means making sure that we have nurses here in the unit in the hospital that can take care of patients, that patients aren't waiting inappropriately for long periods of time in the emergency room, that we have the capacity to take care of people when they have their emergencies. I made the very difficult decision that we're going to go ahead and once again postpone selectively elective surgery. I want to talk about that for a minute because when I say elective surgeries in healthcare, elective doesn't mean unnecessary. Elective simply means that we can schedule those surgeries. And so they're different than emergency surgeries, like when you come in with an appendicitis and you have to have an emergency surgery to get that appendix removed. Elective surgery means that those surgeries are necessary to treat cancer, to treat bariatrics, to treat gastritis, to treat a variety of other medical problems, to get a cardiac catheterization for a stable but critical heart condition. All those things are elective, and we made the decision that we would look at every single elective procedure that's scheduled to come in to Beebe Healthcare and make a determination with your doctor, with our anesthesiologist, with our nursing staff to decide whether that is a procedure that we can wait or hold off, or if we needed to go ahead and perform. That decision was critical because it gave us the opportunity to look at certain types of procedures that would have resulted in patients coming into the hospital for extended periods of time. And if we could potentially ask that they be postponed, as long as it was appropriate, then we would gain some more bed capacity so that people coming into the emergency room with heart attacks, other emergencies could get the bed that they needed to treat those emergency conditions. I've been doing that for the past week to week and a half, and I can tell you that it is making a difference. It is helping us to make sure that we are meeting the needs of everybody who needs their local community healthcare facility. And we will continue to do go down and potentially go down a little bit that allows us to bring back those elective procedures. But please also know that every single elective procedure is evaluated and every day by clinical leadership and also speaking with patients and their doctors so that if someone had an elective procedure that was postponed, we will go back and say, how's that patient today? Does that patient now need surgery in order to or having some life-threatening situation? If the answer is yes, the condition has changed, we will bring that patient in and make sure that that surgery or that cardiac procedure go on. This is something that every state, every hospital in the state, as well as every hospital throughout the country is doing. And so we wanted to make sure that at the end of the day, it was to provide the very best possible safe care, recognizing that that doesn't necessarily mean that it is something that is convenient for you. You may have had family that saved, that took some time off to help take care of you, or that you may have been on a liquid diet for a period of time and now you're going to have to go back on a regular diet, or some of those other things. I recognize that these are decisions that we've had to make with you and your doctor that may have inconvenienced you, caused you suffering or pain. And I'm very sorry about that. But please know that this is all because we wanted to make sure that we provided the highest quality care for you and our community. That's going to continue probably for the next week to week and a half. Please stay tuned by watching our Facebook post, web page, or talking to your doctor, or calling the hospital and asking about the status of your surgical procedure as we continue to move forward. Remember, though, the other thing I want to talk about before I hand it over to Dr. Chazanoff is that everything else is open. We did this so we can continue to run our emergency rooms and keep them open, and that the wait time wouldn't be so severe for both patients as well as the very, very, very hardworking ambulance teams, the emergency medical response teams, all the paramedics out there serving the community. We wanted to make sure that they were also given the opportunity to come in, get their patients downloaded, have patients come into the emergency room and be seen, and go back out and continue to do the great work. So all the clinics are open. Our walk-in clinics throughout Sussex County are busy but open. Our regular patient care clinics and primary care clinics, so you can see your doctor, as well as your specialty clinics, are all open. Our labs, our imaging facilities, CAT scan, MRI, X-ray, all open. PT, OT, speech pathology, all open. Because we clearly recognize once again that there are ways to make sure that you get the care that you need without necessarily having to come into the hospital or the emergency room. And we want to make sure that once again you need to take care of yourself as best as possible. Take care of your diabetes, take care of your high blood pressure, take care of your pneumonias or anything that we can treat on an outpatient basis to avoid you having to come into the emergency. So once again, everything is open. We're doing elective surgical procedures and selectively postponing them as long as it is appropriate clinically and has the advantage or the benefit of opening up our bed capacity. So, for example, our outpatient surgery center, where you don't need a bed, are open and doing the procedures. And again, check with your doctor or the hospital if you have any questions about what is scheduled and whether your procedure has been canceled or postponed. Thank you for your patience with that. And I'll talk more about that later on when I come back. But I want to go ahead and turn it over to Dr. Bill Chazanoff, because I think it's, as we've done since the beginning of this pandemic, to give you the latest, unbiased medical and scientific data on what is going on. And I'll see you later. Dr. Chazanoff, let me hand it over to you.
Thank you, Dr. Tam. I appreciate that. And for everyone who's tuned in tonight, I want to say thank you for your time. And I appreciate you being here so that way we can provide this information to you as our family, our community, our neighbors. So for those of you who do not know me, I am Bill Chazanoff. I am an infectious disease physician and an internal medicine physician. I grew up in Milford, Delaware. Been at Beebe Healthcare for about 4 years. And as always, it's my pleasure to talk to you to give you the most up-to-date information, hoping that helps guide you make decisions as you move through your days and the weeks ahead. In my usual fashion, for those of you who have tuned into our town halls before, I generally start off by providing numbers. So I also like to state that these numbers are all accessible numbers throughout either Johns Hopkins University coronavirus website or through the State of Delaware Division of Public Health coronavirus website. This information that I'm providing to you this evening is not information that only comes out to healthcare institutions, hospitals, such as Beebe Healthcare. This is information that's available to everyone. So please be aware of that. In the United States is where I'm going to start with numbers, and I do want to level set and remind everyone that as we have been dealing with this pandemic for over 20 months now, I want to state that again, dealing with this pandemic for over 20 months. When the illness was first identified in December of 2019, we started to track many numbers throughout the United States, state of Delaware, obviously at Beebe Healthcare as well. Back in 1918, and I promise I won't make this a history lesson, but back in 1918, there was the Spanish flu pandemic. The Spanish flu pandemic was estimated to have taken approximately 675,000 lives of United States citizens. And I'll repeat that number again. So back in 1918, with the Spanish flu pandemic, 675,000 United States residents passed away. Unfortunately, we can say that with this COVID-19 pandemic that we have exceeded the death number to what we saw back in 1918 Spanish flu. We are at approximately 677,000 deaths in the United States from or related to COVID-19. That's a pretty sobering and unfortunate number, and that number unfortunately continues to rise on a day-to-day basis. When we look at the state of Delaware, we have unfortunately lost about 1,929 Delaware residents to or related to COVID-19. One of the numbers that is extremely important that we use, that Dr. Tam had mentioned about the decisions that we make when it comes to procedures, things that we do in the hospital to make sure that we have the capacity to keep all our community and neighbors safe, are the number of hospitalizations that are just not at Beebe Healthcare, but also throughout the state of Delaware. As of this morning, the state of Delaware had reported 229 hospitalizations throughout the state. And again, that is a number that can be found through the state of Delaware coronavirus website. I'm a visual person, so knowing that the number is 229, while that seems very high, I like to put that into perspective. So in normal fashion, I have created a graph that I'd like to share with all of you to show you in the state of Delaware the number of hospitalizations since March 30th of 2021. If you look at this graph, the higher this graph goes up, the more hospitalizations there are. So you can see back in March, April, and May, we had this first peak or surge, if you will, of COVID-19 hospitalizations. Fortunately, we had a decline. Then we had a second peak that went higher than the first one. We have a second peak that occurred in the winter of this past year. Things started to go back down with a little bump, went down. We had very little hospitalizations throughout the state. And unfortunately, now we are back to here. The good news is, and hopefully this trend will continue, that the number seems to have started to come back down for the total number of hospitalizations in the state of Delaware. So we will continue to monitor that. We will continue to talk to our partners in the other healthcare facilities, along with continuing to receive our prediction and modeling from University of Delaware to see where things may end up being in about 7 to 10 days. I think that it's extremely important to talk about the one preventative measure, or one of the most important preventative measures for COVID-19, and those are vaccinations. I'm going to give you some statistics, and these numbers again can be found through the state of Delaware website. According to their website, approximately 78% of Delaware residents have received at least one dose, and those are for those Delaware residents who are 18 years of age or older. So again, those who are 18 years or older, there are 78% of those Delaware residents who have received at least one dose of vaccination. 62% of eligible Delaware residents have received and are considered fully vaccinated. And I think that's an important number to understand as well. In our community, we are seeing and have continued to have seen for the last couple months an increased spread of COVID-19, and that's most likely due to the Delta variant, which I'll talk about a little bit later with a question that was posed that came in for our meeting that hopefully will explain the Delta variant and some other variants. What I will say is that this variant, known as the Delta variant, spreads easier and is more infectious and can make people sicker than the strains of COVID-19 that we've had and seen in the past. So important to realize that. As Dr. Tam had alluded to, we do still see cases of COVID-19 here at Beebe Healthcare. We continue to monitor those numbers on more than a daily basis, actually around the clock pretty much. What I can tell you from what I have seen in this surge is that more younger people are being infected or affected by this, what I presume to be Delta strain, than what we've seen in the last couple surges. So I do think that that's important. We obviously have seen younger demographics, those in their 20s, being hospitalized, and to a higher extent than what we have seen in the surges in the past. One of the things that's also important to realize is that there are breakthrough cases, meaning that people who are fully vaccinated, unfortunately, can still be infected with COVID-19. I say that not to scare anyone, because the COVID-19 vaccine is what will significantly decrease someone's risk of being infected in the first place, but will also, if unfortunately infected, will hopefully keep them out of the hospital and keep them out of the ICU and from becoming severely ill. So please, my first time saying this, if you have not been vaccinated for COVID-19, believe you are eligible, please reach out to your primary care provider or one of your physicians, or let us know at Beebe Healthcare. We will do our best to see if we can help you make that decision. We want as many people to be vaccinated as possible. Right now, the state of Delaware is reporting a breakthrough case percentage of 0.6%, meaning that less than 1% of all those people who are fully vaccinated have reported have reported a COVID-19 infection after being vaccinated. We continue in the hospital, at our facilities throughout the county and Kent County, we continue to use personal protective equipment to keep you safe when you come into our facilities. We also use that to keep our other colleagues and team members safe as we work with them. If you come to one of our facilities, it's important to realize that even if you are fully vaccinated, we still ask people to wear their masks. We ask people to please consider, if they are visiting someone in the hospital, if they are not feeling well, so the visitor is not feeling well, to maybe postpone your visit until you are feeling better. It's extremely important to realize that this personal protective equipment, which was very scarce back in March and April of May of 2020, has improved. So we are happy to provide you a mask if you come into our facilities and you don't have one. We want you to be protected, and it's very important for us to make sure that you are safe while you're in our facilities, and it's just as important for us to make sure that you have the information to be safe when you're outside of our facilities. So one of the things that we are now managing here at Beebe Healthcare and throughout the state of Delaware, and really throughout the country, but really here in Delaware with the State of Delaware Division of Public Health, is that we now have guidelines, and I'll talk about this a little bit later. We have guidelines to help us when it comes to our team members being vaccinated. And I'm going to talk a little bit more about that because there's a really good question that's come in, and I think that that's going to help let the community know where we are with that. It's also important to know that as the Division of Public Health for the state of Delaware is providing us guidelines, we also know that there are federal guidelines that may be signed or executive orders that may be signed from the president that may also influence the decisions that we have to make in order to be compliant and to stay safe. So as Dr. Tam had alluded to, while there's a science to this, we also need to make sure that we are following the rules and the regulations, and it's extremely important for us to stay on top of all of that. So if it seems like things change more frequently than you would expect, it sometimes is because of these rules and regulations, sometimes because of new science that's come out as well. We absolutely do our best and will continue to stay on top of all of those things and make sure that everyone is safe as possible. I do want to talk a little bit more about the vaccines because I think that this becomes a point where it is confusing to healthcare workers, it's confusing to doctors, it's confusing to the clinicians, the nurses, and people who work in the hospital, and also in our outpatient offices and primary care offices, our specialty offices. And that truly is the name of a third dose and the name of a booster dose. Because even though that medication is the same and the amount of medication in that dose is the same, it's extremely important to realize that a third dose by definition is different than a booster dose. So bear with me for a moment. Several weeks ago, a third dose was approved by the Centers for Disease Control, the CDC, and the FDA. This identified a group of individuals within our communities and our population at whole that would benefit from having a third dose of a Pfizer COVID-19 vaccine or a third dose of a COVID-19 Moderna vaccine. The people that are considered to be in this third dose category are those who have certain medical conditions or are on certain medications that cause their immune system to be weaker. Some of those conditions include things such as a solid organ transplant and the medications that are generally taken after that transplantation. There are several other medical issues and treatments that put someone on that list. Now, why this gets a little tricky is that that is a third dose. A booster dose was originally thought to be an extra dose of Moderna COVID-19 vaccine or an extra dose of Pfizer COVID-19 vaccine, which just out of coincidence happens to also be a third dose, although this is called a booster dose. And initially that was thought to be beneficial, or at least announced that it would be beneficial for almost everyone, the general population, I say. What's happened within the last week is that the FDA has met. They don't believe that this booster dose would be beneficial for everyone. What they have stated at this point is that a booster dose would be beneficial for some individuals, and right now that thought is for those who are 65 years of age or older, and potentially other medical conditions that would put someone at risk for serious COVID illness if they became infected. FDA made that statement about a week ago. And what they have now done is they have now passed it off to an advisory board for the Centers for Disease Control, known as the CDC, to see if they can help classify what that actual definition of whom should get a booster dose should be. So we are in a little bit of a waiting pattern while the CDC is reviewing this data to come out to us to say this is who we should be giving a booster dose for. So again, in summary, a third dose has been identified of who those people should be. And Beebe Healthcare and many other local pharmacies and other medical facilities have been giving out third doses for several weeks. We are waiting to get our final guidance from the Centers for Disease Control to start offering booster doses. Again, same medication, same amount of medication, but the definitions are important between a third dose and a booster dose. The other question that I am getting asked quite a bit is, if I receive the Johnson & Johnson vaccine, should I be getting another dose, be it either an extra dose or a booster dose? They are looking at that data at this time, and we are waiting on final recommendations. But as of now, we do not have any of those recommendations for an additional dose after the one Johnson & Johnson dose. Again, I appreciate you hanging in there for that. I know that's a lot of semantics, but I think it's really important because I don't think it is delineated or separated when you're listening to the news and other information. So I hope that's helpful. Another thing that I'm being asked frequently now is if especially since we're getting into flu season and flu vaccines are coming out, do I have to wait a certain time between my flu vaccine and a COVID-19 vaccine? Well, there used to be a recommendation to wait 14 days before or after receiving a COVID-19 vaccine. Centers for Disease Control has taken that recommendation away. So there is no longer that time lag that we used to have as a recommendation several months ago. So I think that is important to realize as people are now trying to get the flu vaccine and trying to potentially maneuver a third dose of a COVID-19 vaccine or potentially start getting booster doses in the near future. What I would like to switch, if possible, is to talk about some of the questions that I have. So I have a few questions. They are a little bit. The second question has a few parts to it. So bear with me. And believe it or not, the first question may have a couple parts to it as well. The first submission was, "Thank you for your hard work in fighting the pandemic. I am delivering a baby at Beebe in December, and I am alarmed and disappointed to find out that Beebe does not have a vaccine mandate in place for staff. In light of the highly contagious Delta surge, President Biden's efforts to enforce vaccines and considering other major healthcare systems across the country require vaccination, will Beebe implement a vaccine mandate for all of their staff? If not, why? Can you share the current statistics for staff vaccine uptake? Beebe has repeatedly reinforced the importance of vaccination." And then it goes on to talk about, I strongly support a COVID vaccine mandate for team members. So I will start off by saying that you are correct. I'm not sure who submitted this question, but you are correct. Beebe Healthcare has not mandated COVID-19 vaccines at this time. And I repeat that we have not mandated COVID-19 vaccines to our team members at this time. Interestingly enough, what we have done is we researched a lot of those the major healthcare systems across the country that chose to mandate vaccine for COVID-19. We met as a team. We made some very difficult decisions. And as opposed to making a mandate for vaccination, we chose to go a different route. We still want a high number and as many of our team members that are eligible to receive the COVID-19 vaccine to receive it. But as opposed to mandating it, what we have chosen to do is to incentivize our team members to get the COVID-19 vaccine. We have decided to promote it in numerous ways internally and to provide those incentives and to be available to answer questions and to guide our team members to make a decision that's right for them. While I won't provide the percentage of our team members that are vaccinated, what I will say is I am extremely proud of our number. We have a percentage rate that is significantly higher than the general population for the state of Delaware, and we are very proud of us as opposed to mandating something, incentivizing to encourage our team members to do what is right. So I appreciate this question, and I hope that whomever submitted this question understands the path that we chose, and to understand that I'm extremely proud of our COVID-19 vaccination rate for our team members. The next question is, if someone is fully vaccinated for COVID and they do have symptoms, signs and symptoms of COVID-19, should they be tested? And if possible, what is the quarantine protocol? So the answer to the question simply, even if someone has been vaccinated, but they are exhibiting signs or symptoms of the COVID-19 infection, they absolutely should be tested. While the vaccine is extremely effective, it is not 100% effective. It has never been touted to be 100% effective. It is extremely important to realize that even if the vaccine is not 100% effective, it is extremely effective to keeping people out of the hospital. It is extremely effective in keeping people from becoming severely ill, and it is extremely effective to stop people from ending up being critically ill in the ICU. So while it is not 100% effective, it is still a highly effective means of stopping one from becoming severely ill from COVID-19. If someone is fully vaccinated and they do become positive with COVID-19, they would follow the same self-isolation protocols that are put in place by the State of Delaware Division of Public Health and the Centers for Disease Control. They would isolate for at least 10 days under the guidance in Delaware of the Division of Public Health. The next part of this question is, should fully vaccinated individuals be getting tested whenever they are not masked and around others or unable to physically distance? Is there a specific test to determine whether someone has the Delta variant? So in communities with high spread of COVID-19, which is where we are right now in the entire state of Delaware at this time, the current CDC recommendations are that if you are a fully vaccinated person who is identified as having a high risk exposure, so you are around someone with COVID-19 or is COVID-19 positive, you should consider getting tested around day 5. And that is if you have no symptoms. If you do develop symptoms even before day 5, you should be tested. And you should consider being tested if you develop symptoms up to day 14. If you have no symptoms at all, around day 5 is a good time to be tested. The other recommendation from the Center for Disease Control, even if you are fully vaccinated and you do have a high risk exposure, is that you should be wearing a mask during that next 14 days in public places. So please keep that in mind. So if you're out in the grocery store and you've decided not to wear a mask because you're fully vaccinated, if you have had a high risk exposure, you should be wearing a mask at that time. The other part of this question is there a specific test to determine whether someone has the Delta variant? So to answer that question simply, yes. There are genetic sequencing tests that can identify if someone has the Delta variant or other variants. I just read, this is another part of this question, I just read about another variant that has been identified. Is it true that as long as people resist getting vaccinated, the variants will continue to develop? Will these variants continue to claim more lives, even vaccinated, because of these mutations in the virus? Do you know if additional stronger vaccines are being researched, developed? Since I have heard that Pfizer, Moderna, and Johnson & Johnson don't seem to be as effective given these variants. Well, what I'll start by saying to this, and for those of you that know me, you know I can talk, so I'm doing my best to keep this as short as possible for everyone, but hopefully to be informative. We know that viruses will always mutate. The best example I can give is that the flu virus, we provide a new vaccine for every season for multiple strains of the flu virus. Each year, that virus changes several times throughout flu season. And what that does is makes the flu vaccine that we previously had less effective. So what we do is we create new flu vaccines every season to provide to community members, our neighbors, our patients, in order to make sure that they have the most up-to-date flu vaccine that should help protect them for the most common strains of the flu virus that are in circulation at the end of the flu season before. It's extremely important to remember that even though the flu virus does have mutations that we see all the time, many other viruses do the same thing. That is not unique to the flu, and that does occur that does occur in many other viruses, family of viruses. You know, it's important to note that COVID-19, even though we're inundated with COVID-19 and hearing about this every day, COVID-19 has only been identified really less than 2 years ago. And we know so much more about this virus now than we did back in December of 2019, January, February of 2020, but we still have a lot to learn about this virus. As these vaccines become less effective and more mutations occur, there is a great chance that there will be modifications to the COVID vaccines to try to make them more effective again. The other part of this question was truly asking a broader topic called variants of concern, is how I look at it. Epidemiologists from our state, so state of Delaware, through multiple other states, through the Centers for Disease Control, they continue to monitor variants of concern. The Delta variant, while being the predominant COVID-19 variant currently, is just one of many variants that are of concern or interest. We have, beyond Delta, we have Gamma, we have Lambda, we have Mu, and there's multiple other strains that are being identified and looked at. I don't say that to scare anyone, because many of those strains actually end up being less infectious, thank goodness, and they end up being less likely to spread to others. But unfortunately, you will sometimes get a strain like the Delta strain that ends up being more infectious, that ends up spreading easier, and that unfortunately can make people sicker. So again, if I had to say a couple things to close this with before passing this back to Dr. Tam, I want to remind all of you, to please stay safe. Remember that, washing your hands, doing hand sanitizing, wearing a mask when you're out in large crowds, even if you are fully vaccinated, is completely okay. And you should continue to do those things. I want you all to be safe. I want you all to consider getting the flu vaccine. If you have questions about the COVID-19 vaccine or are hesitant, please reach out to your doctor, to your provider, ask them questions. Make sure that you are informed to make the best decision for yourself. And with that, I hope I did not put too many people to sleep, and that you all have a wonderful night. And it is my pleasure to turn this back over to our President and CEO, Dr. David Tam. Thank you.
Thank you, Bill. I think you can see me. I'm wearing a mask, and I'm going to take it off because I'm in my office all by myself, and I want our sign language interpreters. They say they can do a better job if they see my mouth and read my lips, so I'm going to do that. Why did I start, though, with wearing a mask? Because I saw a question from Lisa, following up with what Dr. Chazanov said. Should fully vaccinated people wear masks and social distance? And some hospitalization and deaths have been reported from fully vaccinated people. What can be done to battle misinformation? This is what we're doing to battle misinformation. We're giving you the facts as best as we know it. But the fact of the matter is, as frustrating as it is, it's not because there's so many opinions out there, right? And it's also because of how people feel and their emotional state. I'll give you an example of why I still wear my mask even though I am vaccinated, and I wear it everywhere I go as much as I can. So I'm vaccinated. My 88-year-old mom is vaccinated. I went to visit her about 3 weeks ago in California. Healthy. We had a lovely lunch with my sister outside at a cheesecake factory. It was great to see her. We weren't wearing masks because we were outdoors, we were eating. And then later on that evening, I got a call from a colleague that they had become sick and were COVID positive, and that he and I had actually been in a meeting several days ago, and perhaps I need to get tested. I wasn't sick. I didn't feel sick. And I knew in my heart, or in my head, I should say, I was probably okay because the vaccine prevents me from probably getting sick, from feeling sick, from going to a hospital. But you know what? The vaccine doesn't protect me from getting virus in my nose. And my concern, my fear, and I couldn't sleep that night, was whether or not somehow there was a virus in my nose, and somehow during that lunch at the Cheesecake Factory, I gave it to my mom. And that scared the heck out of me. Now, I went the next day, found a place that had COVID-19 testing, and then a day later, I was told, there was negative, that I was COVID negative. And what a big sigh of relief, right? But boy, that 24, 36 hours of worrying if I somehow gave my mom COVID-19, even though we're both vaccinated, was the most difficult thing that I had done emotionally as the leader of a health system for the past 19 months. As a result, wherever I go now, I try and wear my mask, because don't forget, vaccination keeps you getting sick and having significant severity of illness, like Dr. Chazanov said, when exposed to the virus. But it doesn't necessarily put a big screen that says, virus, you can't live in my nose. And that means that you could potentially still spread the virus to other people. And that's one of the reasons why, as much as I ask people to get vaccinated, which is critical because it helps reduce overall incidence of COVID-19 in the community, right? That thing you call herd immunity. Most important thing is wearing the mask to protect yourself and also others as much as possible. That's one of the reasons why here at Beebe Healthcare, we, of course, as you heard from Dr. Chazanov, following the governor's guidelines and waiting to see what the federal guidelines are with respect to mandating vaccines, are putting a policy in place where people will either get vaccinated with COVID-19 or undergo mandatory testing on a regular basis. But in the meantime, what is mandatory is that when caregivers, all of us at Team Beebe, are seeing patients or walking around on the floors, they are wearing a mask, because this is the only way we know how to ensure that we are fully protecting you, the patient, from getting any virus from our nose and our airways to you. I'm making this commitment. If you come into one of our facilities and you see a caregiver not wearing a mask, or having it like here, like this, I'm glad it's a visual. I want you to please email me at dtam@bbhealthcare.org. I may get a flood of emails, but it's that important. Whether a caregiver is vaccinated or not, and I want every caregiver to get vaccinated. As Dr. Chazanov said, we're doing everything possible to give people the opportunity to make the right choice and get vaccinated. What we are making sure that is mandatory, that all of our caregivers follow the accepted protocols where they're wearing a mask, they're washing their hands, they're watching their distances. That's the way we're going to try and do our best to protect you. Because at the end of the day, this is such an emotional thing. I felt terrible when I thought that perhaps I had given my mom COVID-19. Thank God I didn't. I don't want anybody to be in that position either. And that's the answer to my question, Lisa, about masking and distancing, even if you've been vaccinated, because it's people's individual sort of sense of relief and discomfort and fear, about this virus. So you've heard a lot of things from us today. You've kind of heard my sermon about why we need to be doing all these things. Remember, I'm going to be giving you the sort of the bullet points before we close. Number one, please, 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 please continue to work on getting the COVID-19 vaccine. You've heard from Dr. Chazanov about boosters and the third dose. I hope that's clear for you. If not, this thing is going to be recorded and you can go back and listen or talk to your doctor. Number two, you've heard the other part, that the flu vaccine is coming out. It's out now. I'm making sure that our caregivers here at Beebe Healthcare get the flu vaccine as soon as possible so people can be strong and survive any kind of flu and be here to take care of the community. And we're going to be out there doing all kinds of flu clinics in the next several months. Just go to bbhealthcare.org. I think the button you click is on screenings and clinics, and find out exactly where the nearest flu clinic site is in our community and convenient to you. But please make sure, and you heard from Dr. Chazanov, that you don't have to wait days between the flu vaccine and the COVID vaccine or vice versa. Okay? Please make sure you get both, because the last thing you want, folks, is to have COVID and also the flu. That's just going to be a terrible thing for you. And we want you to feel, we want you to be protected. We don't want you to get sick. Number three, Beebe Healthcare is open. Beebe Healthcare is doing business in our primary care clinics, all of our outpatient services, our outpatient surgery center, our labs, our rehab, our PT, OT, home health, hospital at home, and here in our ERs, as well as in the inpatient settings. What we have done is to make sure that we are selectively postponing elective cases, procedures, to make sure that there is optimal bed capacity to take care of people who come into our hospital on an emergency basis. We're doing it to protect you, the community, and to some extent, help our staff manage this. And then the last thing I'll say is that we will continue to be here for you to keep sharing information in a variety of formats, because right now, other than the vaccine and other than some of the things that we have in terms of some of the therapies you might have heard about, like remdesivir or things like that, information is really the biggest therapy that we can give our community on how to get through this pandemic. And we will. On a final note, I've been talking with my staff who are very tired, who have worked very hard during the last 19 months, who have had to deal with issues related to vaccinations and things like that. I've asked them to think about three things: that what will get us through this, besides all the medical stuff, is to remember that faith, hope, and love in our community is what will get us through. Faith in ourselves, faith in your local nonprofit independent community health system, faith in the people who have been with you for the last 19 months to take care of you and to make sure that we have shepherded you throughout this pandemic and your other health issues. And of course, faith in each other and all your other doctors who have been with you to get through this together. Hope. Hope that this thing will settle down. Hope that there won't be other variants. Hope that the people will get the vaccine and that we can lower the spread. And then love. At a time when things are so fragmented, at a time when things may feel politicized, when people are yelling at each other. I was wearing a mask and somebody driving by yelled at me as I was walking down Savannah Road. We need to make sure that we love each other. I don't want to sound like my dad, the Baptist deacon, but I want to make sure that we all know that this is a tough time for all of us. And we need to make sure that we have compassion for each other, that we try and do our best. And I know that all of you know it, but I hope that it's okay for me to share that with you, because that's what I'm sharing with Team Beebe, that we have to continue to love each other and support each other, despite the fact that there are so many things that we are all afraid of, so many things that we may disagree on. But at the end of the day, we all agree on one thing, and that is we need to take care of each other so that we can take care of you. On behalf of everybody here at Beebe Healthcare, our board of directors, our executive team, all our leaders, our physicians, our nurses, our other caregivers, our volunteers, thank you very much for your support. Thank you very much for your philanthropic donations. Thank you very much for trusting us with your care. And we hope to see you again soon as we continue fighting this pandemic together. Have a great night.